The expression mini-stroke is often used to refer to transient ischemic accidents, TIA. These are events produced by an obstruction of the blood flow to the brain. They can be a warning sign to much more dangerous problems. As its name indicates, this type of issue is defined as transient because it does not last for a prolonged period of time. However, this doesn't mean that we shouldn't take care of ourselves. This symptom is a warning of a possible cerebrovascular accident, CVA. Basically, the difference between a mini-stroke and a CVA is its duration. They are both extremely dangerous, but the second could result in considerable paralysis or even. The problem is that both bring with them high risks if you do not seek medical attention immediately. General symptomatology: when a person feels like a side of their face is asleep or that their eye is inflamed, they could be suffering from a mini-stroke. Dizziness and intense headaches can continue the escalation and should put you into immediate alert. All of this may come with the weakening of extremities and difficulty speaking. The most serious thing to keep in mind is that these symptoms are the same as those of a CVA. Naturally, both require medical attention. This temporary anomaly can occur in less than an hour or throughout the course of an entire day. However, there is no standard duration. It depends on each different case. It is very important to react on time to this, since not paying attention to the signals can be lethal. Causes of TIA: anything that causes a momentary suspension of blood flow to the brain is considered a probable cause. Blood clots are one of the triggers that can cause this type of incident. This occurs when TIA are able to block the arteries in a way that doesn't allow for the blood to flow to the cerebral cortex. This all creates a considerable decrease in blood pressure, which can cause an unwanted transient ischemic accident. This is the danger that comes with the thinning of arteries. The inflammation of the blood vessels and diseases like diabetes and anemia are also possible causes of cerebral ischemia. Because of this, it's important that you are aware of all of the factors that can cause this type of circulatory system degeneration. Silent accidents: there are some people who only experience acute head pain and take care of it by taking a pill. Actually, there have been many cases of patients with transient cerebral ischemia that stand out because they only felt this symptom. Population at risk of a mini-stroke: another incorrect belief about mini-strokes is that they can only be experienced by older people. The reality is that, after the age of 55, we have to start taking more precautions. There are many cases of younger people that experience this type of phenomena. Among those at risk of a mini-stroke are smokers, obese people, diabetics, people with a family history of them. This shows that carrying out a healthy lifestyle is the best way to prevent the appearance of these dangerous symptoms and the effects of a mini-stroke. Mini-stroke prevention: overall, everything indicates that carrying out a low-fat diet and avoiding tobacco are the best ways to avoid a mini-stroke. Doing aerobic exercises that promotes internal circulation is also a great idea. Some scientific studies state that taking an aspirin a day reduces the risk of suffering from these cerebrovascular accidents. It is true that this pill can have a fairly quick preventative effect on the body. Thus, it is recommended that you take it to avoid a CVA after the appearance of a mini-stroke. To resume, it is important to know the signs, risks and consequences that are brought on by a TIA. What can start out as a little dizziness can end up being something much more serious if you're not careful. If you suspect that you are experiencing this type of accident, the best thing to do is to get to the closest hospital as fast as possible. Every minute counts, and the consequences of this cerebral accident can be far less serious if it is treated at the right time. Insomnia increases the risk of stroke and heart attack according to data from different studies. Insomnia and lack of sleep can lead to cardiovascular problems. Unfortunately, women are usually the most affected.